Dental cleanings are an important part of prophylactic care here at Animal Ark Veterinary Hospital. Today we're going to take you through the check-in process and the full dental cleaning of one of our favorite patients, Oliver. One of the most important things that we do prior to any procedure here at Animal Ark is make sure that every animal is safe to undergo anesthesia, and we do that with full blood work. Oliver's an excellent patient, and as you can see by his tail wag, he's actually really enjoying visiting with us today. Our state-of-the-art dental suite also includes a fully heated table, 2 different ways to monitor patients, and an x-ray machine similar to what you would find in your own human dentist office, as well as proper ways for us to track all of the teeth in the mouth. As with all of our patients, Oliver is getting an IV catheter that will allow us to administer fluids throughout his procedure, and it's just another level of safety that we like to provide here. Since his catheter is in and Oliver's already had his pre-medication and is feeling pretty good right now, we are giving him another medication that will help him fall into a deeper sleep so that our dental technician can properly place an intubation tube, which she's going to show right here. Now, this intubation tube has to be properly sized for every single patient and properly inflated. Since we do use water scaling during dentals, we want to make sure that no patient can aspirate. So our dental technicians and our doctors take great care in making sure that every single patient is properly fitted for their intubation tube. As you can see here, our technician is properly inflating the tube and checking it to make sure that everything is inflated well and is blocking the trachea completely. Our other dental assistant is helping get Oliver set up on all of our monitoring equipment so that we can check his blood pressure, his heart rate, and his percent oxygen throughout the entire procedure to make sure that he is continuing to do well. And now that Oliver is properly positioned and relaxed, we're going to take a quick before picture just so his owners can see the difference in his teeth prior to cleaning, post cleaning. And as you can tell, he'll have a pretty dramatic before and after picture. Here, Dr. Warden's going to go ahead and do a little bit of a more thorough dental exam by chipping off some of that thick tartar so that he can see the full crown of the tooth underneath, and so that he can get a good look at the gum line and see if there's any gum recession. Every patient that has a dental procedure with us does get full mouth dental x-rays. This gives our technicians and doctors a chance to look for any lesions below the gum line, abscesses, broken teeth, or bone loss that we normally wouldn't be able to see by just checking the crown of the tooth. A lot of the times we can be a little bit surprised because the tooth will seem very firm and have a healthy crown, but will have some issue underneath the gums. This is really important to help identify those problems before they can truly cause an issue in the future and cause your pet more pain. Here you can see just an example of a couple of the x-rays that our dental technician has taken. Dr. Warden, who is Oliver's dental doctor today, will go over each x-ray individually and check each tooth to make sure that all of them are healthy. In this case, he seems to not be finding too many problems until he reaches one of the molars, 109, where he's identifying a possible tooth root abscess. He's going to probe that tooth and talk to the dental technician, Brooke, who's going to be cleaning the teeth so that they can get a better idea of what they're looking for on that front root. While Dr. Warden is interpreting the x-rays, our dental technician is going to use a water scaler to clean the remaining tartar off the teeth so that they can get a proper view of the crown of the tooth and chart every single tooth to check for any pocketing, furcations, or other issues that need to be addressed while we are doing the dental procedure. As we know from the dental x-rays earlier, Dr. Warden had identified a possible problem with the molar 109. Brooke is probing that molar and checking for any pocketing, which she is finding, and is noting that the tooth is a little loose. Dr. Warden will then come in and do a little bit of a more thorough exam with that tooth now that it's clean to determine if we need to extract that tooth or pack some Cleaned Oral, which is an antibiotic gel, around the tooth to help firm it up in its root. After speaking to Oliver's owner, it was ultimately decided that he would need that tooth extracted. Just like at your own dental office when you might have a cavity filled or a tooth extracted, we are going to go ahead and use lidocaine and bupivacaine to block Oliver's mouth. This will help with any pain after the extraction and just make him more comfortable so that he does not feel anything at all. Dr. Warden is going to use a bit of a drill to get out that tooth, and then he's going to loosen up the ligaments to make it a lot easier to pull. This is actually very gentle on their jaws and helps them have little to no pain after having a tooth extracted. Now that all of his teeth are clean and the one bad tooth is extracted, our dental technician will go through and polish all of his teeth with a similar polish that your dentist would use to restore the enamel. This is very important after doing any sort of scaling on the teeth to make sure that they remain healthy and no cracks are left behind. And now that his dental procedure is done and his teeth are all nice and clean, we're going to go ahead and take a quick after photo that we can put on a brochure for his owners so that they can see what his teeth looked like before the procedure and after, along with specialized recommendations for products that they can use to keep his teeth nice and clean and healthy. And here he is, recovering and quite happy after his procedure and ready to go home. If you have any questions about how we can help you with your pet's teeth or any concerns, please feel free to give us a call or reach out on any of our social media platforms or email.